Hello everybody, this is Dr. Doug Williams coming to you with today's version of Posture Points. And this is a little bit different than our normal ones. We're going to go ahead and cover some material that we outlined in a talk we did in our office several weeks ago on the shoulder. And basically it's called a effective three-step shoulder protocol. A lot of people come into our office with problems with their shoulder not working right, pain, limitation, issues like that, and we decided to put together a number of materials to try to create an opportunity for them both to help themselves and better understand what's going on. I'm actually going to be working off a little bit of a prompter on a laptop today, so bear with me if you see my head turn away. We tried to do it on the screen that you see behind you, but the visual wasn't quite right, and I still wanted to get this material out. So let's get started. One of the things that people don't really realize is that shoulder problems really live on a spectrum. One end of the spectrum, what happens is they have rotator cuff surgery, and people have been placed in big slings and can't do anything for 3 months, and that's oftentimes what people think rotator or a shoulder problem is. The other end of the spectrum is what we call dysfunction, and it actually starts out with the shoulder blade or the scapula, which we'll talk about in just a few minutes. So on one end you have surgeries and shots, and on the other end you just have a problem with weakness or position of maybe some of the material in the shoulder itself. Except for in most cases of trauma, we just don't start out with a rotator cuff tear. That just isn't that common on that zone. There's really some main points in the shoulder. We're going to use this model here, and this is actually would be akin to my right shoulder. So I'm going to pull this off, and you have several places. You have the back portion, which is called the scapula or the shoulder blade. The front actually creates the collarbone, or that's called your clavicle, and then this portion here would be the upper arm bone, and that's the humerus. So you have the scapula, the humerus, and the collarbone, the clavicle. So that's the three main parts of it. And then the joints that exist in there, you have what's called the acromioclavicular joint. That's the portion where your collarbone meets your shoulder blade. You have the glenohumeral joint, which is the portion where your upper arm bone sits in a very, very shallow or weak socket. And then you have what's called your scapulothoracic articulation, and that really is the one we're going to spend a lot of time on today. Your shoulder blade itself does not attach to any portion of your frame. It actually free floats on your rib cage. It's held there by muscles, but it's not actually articulating with anything directly. Main muscles that hold the shoulder blade to the chest wall, it's going to be the trapezius. Those are those big muscles that come from the neck to the top of the shoulder. There's the rhomboids, which actually go from shoulder blade to shoulder blade. If you've ever been told to sit up straight or pull your shoulders back, you're using those rhomboids to some degree. You have what's called the levator. It's a muscle that goes on the inside of the shoulder blade up into the neck. We call that the teenage muscle. When you ask your kids, hey, what's going on today, Billy, how was school? And they go, oh, I don't know. That's coming from the levator muscle. And then on the front side, you have a muscle called your pectoral minor. Most people think of the pec major. That's the big chest muscle that goes from your sternum or your chest wall to your arm bone. That's what the bodybuilders flex. But you have one called your pec minor, and that actually goes from the front part of that shoulder blade to the chest wall. Now it's going to be very important here in a minute. The reverse of that, or what people oftentimes think of, are the rotator cuff muscles. Rotator cuff muscles are oftentimes called the sits muscles. They're the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. And while names are important, especially if somebody's going to cut on them, for our purposes, mostly what you need to know is the rotator cuff muscles are small muscles. They come from around the shoulder blade, and they attach to that upper arm bone or that humerus. And their only job, or their main job for sure, is just to keep that shoulder socket, that upper arm bone into its central area. It's to keep it from drifting too far out of position. If those muscles become weak or they become damaged, then that upper arm bone, that humerus, will slide forward and it no longer is working in its normal position. That's where a lot of problems come from, as it begins to bump up against the collarbone, or it becomes compressed and blood flow in that area is poor on that. So the rotator cuff muscles are small muscles, and their main job is to keep that humeral head or that upper arm bone right in that sweet spot. The shoulder blade muscles are big, strong muscles. They're stabilizers, and their main job is to lock that shoulder blade up against the chest wall so that you can do whatever you want with your arm. Most common direction for the shoulder blade to malposition is forward, and that is pretty darn common. And you'll see that shoulder blade, instead of staying back like you think about somebody having good posture, that shoulder blade rolls forward or anterior and lateral. When that happens, like we said earlier, that begins to compress some of this tissue in here, and that's when people start to have some problems. So oftentimes, like we said, you'll see that with different postures, and when you look at someone from the side, for the most part, their ear should be over their shoulder on there, and then the farther that slips forward, the more the shoulders want to follow it, so that shoulder blade rolls forward, and it begins to compress this portion in the front. And that's again where those rotator cuff muscles live, and they start to get irritated. So oftentimes those rotator cuff muscles get irritated because of the position of the shoulder blade. Well, if you think about it, today's society is almost made for that to happen. With computers, we sit and we hunch forward, especially laptops. People are oftentimes on phones or personal devices where their heads are tipping down and forward. Most of our furniture nowadays is super soft, and it allows you to sink in, and your head begins to position forward, and all those things begin to drive all of that shoulder blade malposition. And as that occurs longer and longer over time, it just continues to collapse that small area in the front. The rotator cuff muscles get irritated, inflamed. The person oftentimes ends up in the orthopedist office because of that kind of generalized pain in that area. They might get a shot or a steroid injection or some anti-inflammatories, and it calms it down for a while. But because they're still working on their computers or on the soft furniture, or talking on their cell phones or texting, that malposition just continues, and the problem rolls on over time until eventually there's enough damage to the muscles in the front, the vascularity is poor, and they end up getting into surgery. Unfortunately, what happens with the surgical situation is they might go in there and open up a space or repair some tears, which can be important. The person rests it long enough so they get enough of the inflammation to be decreased, but they're still left with that abnormal posture. And then when they get out of rehab, when they get out of surgery, they're sent to physical therapy, and they oftentimes will get rehabilitation exercises. And what they'll give them is they'll give them rehabilitation exercises for the rotator cuff muscles. So you might have see people get a tubing exercise where they're strengthening these muscles in the arm bone. And really what all of those exercises tend to be related to is strengthening the muscles that move this upper arm bone, that humerus. And while that can be important after that rotator cuff muscle has sat for 3 months with no activity after a surgery, it's not changing the shoulder blade posture position at all. And that's really where a lot of the problem comes in, is they strength train this rotator cuff muscle, and boy, that sucker's solid, but because it's rotated forward, it's not in the shoulder blade's out of its normal position, they just start right back where it was. And oftentimes you'll see that shoulder doesn't heal quite right, or then the other one begins to bother the individual. So those conditions, while it may be important to have that surgery done, if the rehab isn't focused at some point on where that shoulder blade lives, it can end up to be quite a bit of problem later on. The next problem that usually happens after rehab is that people may be giving some exercises to work on the shoulder blades, and that's a step in the right direction. So they might be given an exercise where they put tubing in front of them and they pull the shoulder blades back, and that's valuable to some degree, so it begins to pull that shoulder blade back into its normal position and activate those muscles. So that's a step in the right direction. But remember, in the beginning I talked to you and I said that the shoulder blade itself has some place where it's supposed to live, and it only attaches to the rib cage via muscles. So the shoulder blade actually reflects oftentimes what that rib cage posture is. So if you have somebody that has an increase in their curve in their back, so if their rib cage is flexed forward, they might do some exercises to bring those shoulder blades back But if nothing's ever addressed to their rib cage to open their rib cage up, that's just a temporary maneuver to move those shoulder blades. So the third part actually of changing shoulder dynamic is to address the rib cage. You do want to strengthen rotator cuff muscles if they've been damaged, but that's usually not the initial stages of a condition and really only for a short time after surgery. You do want to work the muscles that begin to bring the shoulder blades backwards. That is important, but that's really something that should happen only after you've taken that rib cage posture and you've begun to stretch that back out. Now there's several ways that you can address that. Musculature and ligaments and discs that actually hold a rib cage posture really require a longer, stronger force than the few minutes even of exercise or some tubing. They literally take being placed in a neutral position, or actually from neutral into almost what we call hyperextension, for 10 or 12 minutes. If you want to remodel posture, then you really have to spend a little bit of time stretching it out. Those tissues, if you could just exercise them back in place really quickly, that'd actually be bad, because then every time you pulled on something forward, like went to start your lawnmower, or lifted one of the kids up to set him on a chair, that would blow you back out. So the structure that holds your posture correctly requires long forces or loads. You can accomplish that in various ways. There's different materials on the market that allow you to stretch over that. Oftentimes we just have people roll up say a bath towel and place it in between the middle portion of their back and lay back over that, and starting out at 5 minutes, and then they work their way up to 10 or 15 minutes. Some postures people have had for a really long time. They have arthritic changes, and you have to apply some other modalities to that, some heat, maybe some, in our case we use a lot of spinal adjusting to create mobility there. But the bottom line is getting that rib cage to stretch back into that 10 to 15 minute zone on that. So step one is to get the rib cage back where it needs to be, whether it's laying over a rolled towel or a special traction device or maybe even a foam roller. Step two is to take the shoulder blades and strengthen those to come back. And then step three, which is only if it's necessary, is to work on the rotator cuff muscles. So you want to do that in a good sequence. That's really how you get at some of the fundamental shoulder issues. Now if you currently have a condition that's very, very painful or limited, and it's if it's on a scale of 1 to 10, if you're living in the 7, 8, 9 zone, you probably need to be talking to an orthopedist, or at least get some acute care for that. If on the other hand your pain is more stiffness, it's limitation, it's somewhere between 2 and 6, and it has moments where it gets bad, but it isn't living too poorly on that, then that can oftentimes be amendable to those other 3 protocols of restoring the rib cage posture, strengthening the muscles in the shoulder blade, and then finally, if necessary, the rotator cuff muscles. So today I just wanted to give you a little bit of background on that information. You can go to our website at carechirolafayette.com and click on our blog portion, and that will bring up an article that has a couple of good things on it. It's got a little bit more about this that we've talked about. There's also, following up with that, the very next blog post is our 2 best stretches that I really like for the shoulder on that portion. We also, when we did this in class, we have a fair amount of handouts that we gave with some stretches and some other things. So if you would like a copy of that, you can go ahead and contact our office at 765-448-6489, and we'd be happy to get that out into the mail to you. So, all right, I hope you're having a good day. Thanks for spending the time with me today. This is a little bit longer than our normal Posture Point ones, but I wanted to give you some heads up on that. And I think our next one actually might be another longer one, but we're going to be talking about some Alzheimer's prevention strategies. So, hope you have a good day.